Okay, so you've been pushing, and now it's time to actually deliver your baby. So what's going to happen at this point is the nurse is going to call the doctor, and this is sort of the dirty little secret. We really, as physicians, as obstetricians, we really don't spend all that much time in your room, quite honestly. But when it's time to deliver, that's when the nurse will bring us in. We'll get into our gown and gloves and get all ready. We'll get the bed in a position, the right position, and then we'll have you do those last few pushes to deliver the baby. First, the head will come out. Then we usually ask you to stop pushing, and we'll use a suction to suction the mouth and nose of the baby out. And the reason is there's all kinds of secretions and mucus. There's amniotic fluid, and the baby's going to take a deep breath. We don't want all that to go down into the lungs. So we usually try and get some of that stuff out first before the baby takes that first big breath. Once the head's delivered, then the shoulders are delivered and the rest of the body comes up. At that point, the doctor will clamp the cord, and then the cord will be cut. Usually by the doctor. If your husband wants to cut the cord, this is one of the opportunities to do so. Make sure you let the doctor know that that's what he wants. If he's looking like he's going to pass out, we probably won't let him. But otherwise, the cord will be cut, the baby will be handed to you, and the nurses will dry the baby off. Now, sometimes, for some reasons, we're not able to hand the baby right to you. In that case, we'll put the baby in the warmer if we need to do a little bit more resuscitation or a little bit more work on the baby that can't be done on your chest. And that's why we have a warmer in the room. Different hospitals do different things. There will always be the person that's going to deliver your baby, whether that's your doctor or your midwife. There's going to be a labor and delivery nurse or two, and there may be some people from the nursery to help care for the baby when the baby's delivered as well. So there's sort of a lot of personnel in the room at the time of delivery. And we're all there basically to make this as safe as possible for you and your baby. Well, that's sort of the process of delivery itself.
Medtwice.com